So we met Chanda 3 or 4 years ago, and we noticed she has big problem with her feet, and her mother left her because she couldn't help such a handicapped kids. People there are very poor, they have no education.
चलने में तो बहुत शर्म ही फील होता था, मुझे बहुत शर्म लगता था कि मैं एक बीमार हूँ और दूसरे लोग मुझे बहुत खराब से दिखता था और मुझे अच्छा नहीं लगता था.
So I first got to know the story of Chanda when I was contacted by a French lady almost about 6 months ago. She's a shy girl, like combination of her personality, living in an orphanage, the circumstances that she lives in. I suspect that some of her shyness and withdrawn personality is also due to the fact that she has these gross deformities of her feet, wherein her feet are pointing completely backwards. Normally you stand with your feet and your toes are pointing ahead of you.
चलने में बहुत प्रॉब्लम होता था, बहुत दर्द होता था चलने में. दोस्त लोग तो हमेशा खेलते घूमते, तो मुझे भी खेलने का लिए बहुत दिल लगता था, लेकिन हम खेल नहीं सकते.
So we made a plan about how we would approach it. We would take it in 3 stages, and we counseled her. She was keen. She had no hesitation in saying that, I want to go ahead with it.
I think she had no fear. We saw her yesterday before operation, and she was quiet and smiling and even knowing what will happen today.
And at this stage we have completed the first stage of applying the frame. We have broken the foot at 2 different places, each of her foot, so that the bones can be reshaped, can almost like sculpted back to its original position. We hope to do the second stage maybe in a month's time. The frame will be on her feet for close to about 3-4 months, and afterwards there will be plaster. At the end of it, we hope to get her feet straight, looking normally, fitting into normal shoes, and pain-free. So we are now at this final stage for removal of the frames, and she will have plaster casts on her feet for about 6 weeks. It's taken us 5 months and a little bit extra to get where we are right now. She has undergone 2 stages of surgery in both her feet. The deformities are now fully corrected. So we have maintained it in the frame for a little while.
We had a very wrong idea about Indian hospital, and when we arrived here it was a big, huge surprise to see how modern and clean all the people, from reception to Dr. Padman, his assistant Dr. Varun, they are so kind.
And we are now ready for the final stage, which is actually not a big procedure. It is removing the frame which has been on her feet for the last 5-6 months, and then we will get her to stand up and start walking.
मैं जाके अभी चलूँगी और जूता अच्छा पहनूँगी, चप्पल अच्छा और सारे फ्रेंड और सारे आदमी लोगों से मिलना चाहिए.